So what do? Well, we look at the whole person. We look at the brain. We look at the peripheral nervous system, the central nervous system, and not only make sure all the parts are there, like the MRIs and the X-rays and the CAT scans that you've got, but we look at the function of the nervous system. Remember that all pain, numbing, tingling, all of those things are sensed and perceived up here in the brain. So brain-based therapy looks like this. We have this area here, the cerebrum. And pretty much everybody knows that's the cerebrum, the higher centers of the brain. The right side over here crosses over and controls and perceives and controls the body, perceives pain and controls the body on the opposite side. This side of the brain crosses over and controls that side of the body. With the cerebellum, which we also call our reptilian or our primitive brain, that's the brain that controls all of the regulatory body functions, from heartbeat to balance to fine motor coordination to different things that manage and run your body. With things in nature, stresses can actually overcome the brain's ability to adapt to those things and can become injured. How do these things happen? Through chemical stresses. I recently had somebody who was in a field, a plane was flying really low. She looked up and said, "What is that?" and got sprayed with chemicals they were spraying in the field. Wow, that was a major injury to her nervous system. The other stresses are physical stresses, which we most commonly think of. Physical stresses like you might have been in a car accident, a slip, a trip, a fall, bad posture sitting at a computer. Another one that's very common that can injure the brain and therefore the body is emotional stresses. I just had somebody come in today who told me that had a very close member of her family die in a terrible accident. Well, these stresses put stresses and cause injury to the brain, and these sort of traumas combined or even all alone will cause a decrease in the brain's frequency of firing, not activating the brain properly. When that happens, we're going to have asymmetries or imbalances with how the brain is working, and that's what can lead to the conditions that I have people coming to me for. Back to my notes, I'm going to read the notes. Conditions successfully treated for brain-based therapy: chronic back pain, insomnia, lack of sleep, chronic neck pain, restless leg syndrome, chronic sciatica, leg pain, hand, foot pain, numbness, spinal stenosis, migraine, chronic headaches, failed back surgery, we can help out with that, chronic shoulder, arm pain, tingling, numbness, burning, balance disorders, dizziness, fibromyalgia, tinnitus, which is ringing in the ears, tremor problems, carpal tunnel syndrome, stroke rehabilitation, peripheral or diabetic neuropathies, other types of neuropathies, MS, chronic fatigue syndrome, ADD, ADHD. These are all brain conditions and can be helped with brain-based therapy. So now you might be wondering, well, gee, how can this brain-based therapy help me out? How does he know if I'm a candidate? That's the purpose of day one. You're going to come in, we're going to need to do a thorough neurological exam. The purpose of the neurological exam is to measure one side of the brain, the cerebellum, the cerebrum, to see how one side is functioning compared to the other. We will do computerized testing. In just a minute we'll go into the exam room and I'll show you what the surface EMG is all about and what the infrared thermography is all about. So we'll go ahead and test the muscle system. We'll test the nervous system, the function of that, through computerized testing and through examination. We will need to do a very detailed, comprehensive health history. I'm telling you now, because with this link or with this DVD, you will be receiving 3 or 4 forms. One of them is the neurological assessment form. Fill it out in as accurate detail as you possibly can. That's going to start pointing to me, just based on how you fill that out, where areas are having trouble in your brain and how it's affecting you. The metabolic assessment form. This is going to be telling us how the metabolism's working, the hormone system, the blood, if there's any autoimmune disorders. These sort of things are going to be very necessary to your condition because, for example, if there is a gluten sensitivity, if there's a peanut allergies, things like this, that can cause back pain, that can cause neck pain. And instead of just treating your neck pain, what if it's caused from one of these sensitivities? We need to know that, or you're going to keep coming in back and back again and back again and back again like you've already been doing. So we need to get to the root of it. And then After day 1, which we do the comprehensive examination, we will do a detailed report of findings. Every stone, there will be no stone that won't be unturned. We will look under every stone to figure out exactly what's going on. Part of the recommendation is going to be possibly working with other doctors. I have medical doctors, acupuncturists, and other practitioners who we work integratively with, and that's another thing that makes us different. So we may need you to help, we may need help from other practitioners to get your case fully corrected. Okay, so we're going to need you to bring in all of your x-rays, MRIs, any blood labs, say a year or sooner if you have any blood labs. X-rays, if you can't get a hold of your narratives, and again, if they're X-rays or MRIs, if they're 5 years, 6 years old, get them if you can, do the best you can. If you can't get those, you may have a paper narrative. A narrative is what the radiologist had written about that. Anything like that would be helpful. Just gather the best that you can, get what you can, and bring that in. Also, make sure you fill out the attached neural assessment form and the metabolic assessment form and the other form there. There's 2 other forms there. I know it's a lot of pages, but this is going to give me the information necessary to finally put this problem to rest, or at least get this problem figured out, so that together with the other doctors, the other practitioners, we can finally work together and work on a solution to this, like I said, with that exit strategy. So the brain-based therapy, again, is to help integrate and heal your brain, and when we do that, we can heal your body. Some of the things that we'll do is we'll provide, in addition to the therapies that we do, I'll provide homework. That's determined on day 1, day 2, as we continue to go. Homework is at-home exercises, just like at physical therapy. If they notice that you have a weakened bicep because it's been in a cast from that broken bone, your bicep gets weak on this side, what do? They'll actually give you exercises like this and all different kinds of exercises, and with that resistance and stimulation to that muscle, you can actually get the muscle to regrow. With neuroplasticity, that big long word again, with neuroplasticity, what we said earlier is that we can actually get the brain to regrow. We can actually lay down new neurons, new fibers. That's neuroplasticity. And with brain-based therapy, that's exactly what we're doing. So I thought it would be interesting. We'll go ahead and reset up over here, where we're going to show you a few of the brain-based therapies that we utilize to help get these results. So